Hi everyone, here we are with Myrian again. It's been just few days since I treated her right knee and it was a remarkably improvement in the extension of the knee. I also told you, and we did some tests for the neck, for the spine, that the main goal of hair treatment is to improve the mobility of the thoracic spine. Here the spine is completely flat. It should be rounded, it should be what is called a kyphosis, which she missed for some reason. She had an injury with a fracture on the right wrist, and when while she fell off the stair, she said she landed on all the sides. So probably, I suppose, it may be some restriction on a rib, which then twists and you lose the mobility of the upper thoracic spine. This is a very, very important area of the body for a serious reason that I won't tell you in this video, but we need to recover. This is the most important things now. So at the end of the session, I will be happy when that feature will go. The spine needs to move in all its parts. The lumbar spine, I checked last time, it was moving better. The knee was more able to extend like the other one, but now again, we need to improve this area of our body. Okay, if you lie on your back, but before, let's do some tests before. Let's do the test with the neck. Show me again the rotation, okay? And the side flexion, which is even more important. Okay, now try to bend all the spine. Okay, and this we will compare with the previous video. Do it again, the side flexion of the... Okay. This looks very good. To me, when you go this way, it already seemed that it improved. But we will compare with the previous video. Now, can you please lie on your back with the head here? Yeah. So the mobility that needs to be improved is around the thoracic spine. So I want to check the rib. I will go underneath the rib, this way, and I will start pushing the rib up, forward, basically. I feel this side is a lot more. Yeah. Okay, so the right side of the rib is completely different than the left. While the left I can push in, and is definitely quite soft, here is very tender, okay? There is no movement. Now, if I move the shoulder down, there is also restriction in the mobility. Both sides, because if you have a rib around here, it will restrict, it will create a rotation, so both shoulder, it won't be able to be depressed properly. Otherwise, the shoulder needs to go down, so if I push you here, she should go down a lot. It's like a side flexion of the spine. Now, neck here is a little bit more stiff. Is it painful here, yeah?
Yes.
This is the brachial plexus, so she had a fracture on the wrist, so it matched with the restriction that I feel here. I want to check the skull. Just relax. We stay like that for a minute. Again, my treatment is very light. The patient usually don't feel much. Lift your head a little bit. Okay. Now. I use palpatory scale, so I don't need to move anything. I already feel what's going on. I need to understand if there are other kind of injury on the head, on the neck. It takes time. Take a deep breath. This is a test for the first rib. you ask the patient to breathe and you need to feel up and down. So something that push your finger up is good enough. Yeah, there is a mobility. Just stay like that. Here I will treat definitely, I will recheck the rib, but also we don't need to forget that there is a fracture here. If I try to push, hold the wrist like that, it's extremely hard. If we compare with the other one, it's completely different. So here, it's like if there is no space in between the bone, okay? If you try to push again against your wrist, you feel the space. Here you cannot. You cannot. So there is no mobility, and also when you have an injury here, you get an irritation of the brachial plexus. So a bunch of nerve that come from the neck area. So the neck, you won't work as before anymore. The rib, this part here, is it this one? Yeah? Yeah. It's a bit painful. So it's not the top of the rib, it's like probably the third, the fourth, around there. Okay, I will treat the patient. The ultimate goal, as I told you, is to restore the mobility of the upper thoracic spine. Is extremely important because there are a lot of important connection there. There is the innervation from the vessel of the head, there are a lot of organs, the heart, the lung. It's very, very important, okay? The spine needs to work properly, because otherwise, if your body is twisted, there may be some compression, and we don't want that, okay? So I will treat her, and so today I treated mainly the right wrist. There is a fracture there, there was a lack of mobility, and also there was a sensitization of the brachial plexus. So this part of the neck on the right side, it wasn't bending much. Now, despite the fact, I found an interesting thing. When she landed and fractured the wrist, not only she landed on the shoulder, but she also hit the head. Okay. In fact, the next session it will be on the head, and probably the head will make a difference here. The mobility of the neck definitely improved. There is a more mobility on the shoulder, which I'm quite happy. I rechecked everything, more or less. There is. I didn't show you the knee, but obviously I showed last time. The knee as an improvement. I go on the other side, is more visible. So this is the right one, the extension, and this is the right one, and this is the left one. Okay, a mild difference, but way better than before. Today I was basically like this and this for a while, probably 45 minutes. I treated the wrist. At some point we both felt a click. So there was a kind of a click, a release. The movement that I felt, there was a compression around here, improved, and now there is a rhythmic motion, and obviously the neck released completely. So from the treatment here, I can achieve an improvement on the neck. This is the goal, okay? What is the next? I already know. I checked the skull. When I touch the skull, there is a movement that closes around the occipital bone here. In fact, I was testing before, if I push this side of the head and this side of the head, she felt that this side is completely different. It's very stuck. Also, if I do this and this, you feel the difference? No. This side is harder. So all this area is a lot harder than the other one. The neck improved, the shoulder moves better. I try to keep the treatment around an hour. So today I don't have the time. It will be the third session. So the third session I will treat this area here, the occipital bone on the right side, and we see if we can get rid of this lack of thoracic spine mobility. Thanks for watching.